everyone, my name is Miley, and today I'm going to talk to you about oral care and prevention of nosocomial pneumonia. So my specific thing is for preventing pneumonia, I'm going to mostly talk about non-ventilator acquired pneumonia. As you all know, hospital-acquired infections usually are infections that occur in the hospital, such as pneumonia, a UTI from a catheter insertion, or other infections that occur in the hospital setting. Hospital-acquired infections cause many deaths per year. Hospital-acquired pneumonia infection is usually has the highest mortality rate. But UTIs are the most common hospital-acquired infection in the hospital setting. Approximately 1.7 million hospital-acquired infections occur in the hospital setting in the United States. Of that 1.7 million, it results in 99,000 deaths. It's really important to be aware of hospital-acquired infections. In one study, the number of deaths that occur from a pneumonia hospital-acquired infection was likely to about 60% compared to all the nosocomial infections. One way to prevent hospital-acquired pneumonia is through proper oral care. So the risk factors. The risk factors for hospital-acquired pneumonia, the first one being a long duration stay in the hospital. Usually patients who have a long duration stay, they're usually in bed most of the time, not getting that proper motility, and are more at risk for other infections. Age has a big factor on a risk for pneumonia, because usually the elderly, they get dry mouth, they're not taking proper hygiene, taking care of themselves and cleaning the bacteria in their mouth and the oral mucosa. Immobility, like I said, is another risk factor. The patients are not getting that turn, cough, and deep breathing, and not moving around, expanding their lungs like they should be. Swallowing impairments is another big risk factor. People who like this could be had a stroke or any other swallowing issues because of surgery or anything else. They are at high risk for hospital-acquired pneumonia because they could not be chewing and swallowing properly, and the food gets aspirated into the lungs, causing bacteria buildup and pneumonia to occur. People who have chronic respiratory disease is another big factor, and patients on continuous tube feedings are at risk for hospital-acquired infection because they're continually getting the tube feeds, and they may not be properly taking care of a bed elevated, and they might be silently aspirating. Ways to prevent hospital-acquired pneumonia. The first one, that's the easy one that almost everyone can do, is when the patient's in bed to raise the head of bed up to 30 degrees. And it's also important that after they eat that they also remain 30 degrees head of bed elevated. And they should, with patients, like I said, on continuous feeding, should always have the head of bed elevated. And it's also important to educate the family members in the room to take those precautions also. Performing proper oral care uses the guidelines, which I'm going to talk about in the next slide, about the proper ways to provide oral care for patients with risk for pneumonia or any other patient. Conduct and document oral assessment at least once per shift. It's important to assess your patient's mouth, assess for any breakdown or any food residual in the mouth, and document and let the doctor know if there's any abnormalities that should be noted. Check for residual for patients on continuous feed. Some patients may not be digesting the food properly in their stomach, and it's important to hold the tube feedings so they don't get a risk for aspiration. If applicable, the patient is able to educate them on the use of an incentive sabrometer, so that way they can expand the airways, expand the alveoli in the lungs, so that it doesn't stick together, doesn't cause bacteria to grow and cause pneumonia. And turn, cough, deep breathe. Educate the patient on the proper use of that, so that they can get that kind of movement and expansion of the lung, like I said before. So the oral care guidelines. The first step is always complete oral care in the morning and the evening, and as needed, such as either after they have a snack or something, or if they if they get medications with applesauce or pudding, it's always important to provide oral care and educate them on the proper use of oral care. So the first thing you should do is always proper hand hygiene. Wash your hands and put some gloves on before you use oral care. If the patient has dentures, remove their dentures and do a brushing an upside down movement to clean their dentures. Also, patients who don't have dentures, they can use a soft toothbrush and gently brush their teeth also in an up and down motion. And then always brush their tongue and then replace the dentures and then apply moisturizer around their mouth. If the patient is able to and is alert-oriented or is independent or can do it themselves, just educate them on how often you should do oral care for themselves and proper hygiene for themselves to prevent hospital-acquired pneumonia. These are my references. I'm also going to show you guys a brochure that will email to you guys, so that way you guys have a quick access to what I've just taught you. This is my brochure that I created for you guys, and like it basically has most of the information that I've already explained to you guys. If you guys have any questions, just email me back, and I will also email you a survey and a quiz just to assess how much you learned today. Thank you.